important conversation. I think what the Qiao Collective is doing in this moment is important and key to developing a better understanding of not just uh, how this affects China, but also how this moment can actually bring sort of together an anti-imperialist camp, a socialist camp, or a new reference for how we confront not just the pandemic of the coronavirus, but also the capitalist decay and austerity that comes along with it. I'm asked to talk about Cuba, and I'm honored to do so because Cuba is a small, heroic island that is resisting in the sea of capitalism. Cuba, with its 11 million people, dares to give the world an example, a small example about what it would take to provide an alternative to the world we see. What would it look like to live in a world in which healthcare is not something that we take as a base for profit, but is actually a universal human right that is accessible to all? But many of people today like to talk about Cuba's example of healthcare as something completely untied or disconnected from the fact that in Cuba there had to be a socialist revolution. The Cuban people actually had to embark on a complete transformation of their society in order to provide healthcare to their people and to the people of the world. In 1959, when the Cuban Revolution triumphed, Cuba could only count on having less than 3,000 doctors available. Half of their doctors had previously left to the United States in light of the revolution. 3,000 doctors left for a population of 9 million. And now, under the impact of a cruel and inhumane US blockade, whose intention from the beginning, its only objective has been to bring the Cuban people to heel, to bring them to submission for refusing to align with US imperialism. Now, the immediate task of the Cuban Revolution was how to reorganize healthcare as a task of all the people. How does healthcare not just become a right per se, but how does it actually become an endeavor in which everyone participates? Cuba had to redefine that healthcare that was revolutionary required redefining what the human was. The human now was to be understood as a social being. We look at the biological, we look at the psychological, and we look at the social conditions that make up the human being. So healthcare had to be tied to other gains of the revolution, including the right to housing, the right to eat, the right to work with dignity and in decent conditions, the right to culture and education. Now, understanding that healthcare and science in particular are now a right of the Cuban people, it's been amazing to see that in more than 50 years of the Cuban Revolution, they have gone from barely having 3,000 doctors to producing a nation that can count with 95,000 doctors and 85,000 nurses, among other thousands of health workers in the island. This is a remarkable feat for a small island that's had to be faced with the most cruel and worst sanctions from its neighbor to the north. Knowing that it has to face a blockade and sanctions that cripple its ability to access important medical supplies, medicines, and other resources, the Cuban model of healthcare has had to focus on how do you build prevention and attention from the bottom up. The whole system has been geared to what is the role that the family doctor, based in the community, working and living in the community, eating every day in the community, walking around the community every day, can do in relationship to the community itself. And it's at this level that the majority of the 11 million people in Cuba actually receive healthcare. From then, there are polyclinics, community hospitals, specialists around the country that treat at a greater level. But the main focus and the emphasis is on how can most health conditions can actually be prevented and dealt with at the base, at the community level, before it can become a costly and difficult problem to deal with in the specialist level. The case of the coronavirus has actually been a great example to look at how the Cuban system works. In the first week of the coronavirus arriving in Cuba, Cuba was able to mobilize its large army of the white coats, as it's called, an army of consciousness and science that is moved by a desire to help the people at all costs. Serving the people is the true mission of the Cuban doctors. 9 million people were visited at their homes. Cuba did not have the capacity or the possibility, despite receiving important aid from China and other countries, it didn't have the possibility to test everyone for the coronavirus, but it did have the possibility of visiting every family on the island. Over 9 million people tested to see if they had any active symptoms. This was only possible due to its amazing human resources. In this process of talking about Cuba's healthcare and its amazing ability to combat the coronavirus and many other pandemics throughout history in the last 50 years, we have to also understand that internationalism has been at the core of the Cuban model and its experience since the beginning. Among Cuba's first brigades was a medical brigade that was sent to Algeria in 1963, inspired by the liberation struggle of the Algerian people, understanding that if Cuba wanted to fight for itself, it needed to fight for others as well. Since then, we have seen that Cuba has actually had possibly the numbers are at least 400,000 Cuban doctors, nurses, and other health workers have been collaborating in over 100 countries around the world. At the moment, Cuba has 37,000 doctors working in 60 different countries in long-standing missions. In the reaction of US imperialism against the Cuban people and their socialist project, we've also seen how the US government has actually pressured many countries to expel the Cuban doctors. In the last 2 years, we've seen particularly the experience of Cuban doctors being expelled from Brazil, from Bolivia, from Ecuador, which are precisely countries that today have high tolls in the coronavirus. Not just because they expelled the Cuban doctors, but because they, as Cuba has reminded in its recent statement, these countries are also the countries that engage in massive budget cuts against healthcare systems. These countries want to continue to be examples of neoliberal austerity in times in which the world needs serious intervention by the state and the people in order to guarantee the well-being of all. In this moment, it's incredible to see it and an impressive experience that the Cuban people, again, in their internationalist spirit, despite all the critical conditions that the sanctions present, has, from March 21st, sent out 21 medical brigades, precisely to combat the coronavirus. At this moment, there are specifically 1,154 health workers working in 20 countries. And as we speak, Cuba is now preparing a brigade of 200 doctors to leave to Argentina soon. An important part also of Cuba's internationalist medical project and of its spirit of cooperation is that since an early period, going back to the 70s, knowing that Cuba needed to create its own independence in the biotechnology sector, it's developed its own biotech industry to meet its internal demand, but also produce low-cost medicine for the world. Right now, Cuba has been able to produce important medicines and vaccines to treat things like lung cancer. They have created the interferon alpha 2B recombinant, which is being used mostly to treat HIV and hepatitis, but is also now being used to work with different respiratory diseases, including COVID-19. And through the socialist cooperation between Cuba and China, there was actually a transfer of technology from Cuba to China that allows China to actually set up multiple factories to produce this and actually provide this at even lower cost to peoples around the world. Ultimately, this moment has proven that capitalism cannot offer any alternative to the people of the world. Cuba, along with other socialist nations around the world, like China, Vietnam, Venezuela, and even the example of a socialist-led state in Kerala, India, prove that only a system, only an ideology that puts people at the center can provide for the well-being of the people. I would like to say that ultimately, this moment of the coronavirus with its corona shock, as Dr. Vijay Prashad would say, is bringing us to a moment in which, for the first time since the collapse of the Soviet Union, we have the reemergence of a socialist camp that offers a true reference for the world. And it's our duty as revolutionaries, as people who are progressive, to actually raise consciousness through the socialization of the experience that these socialist countries bring forward. Thank you for this opportunity and looking forward to the Q&A.
So next we move to our next speaker, Tina No, who will speak on Vietnam's experience.
Yes, hi. Thank you so much, Manolo, for that beautiful, very inspirational presentation on Cuba. My name is Tina No, and I'm a Vietnamese immigrant and a member of the Party for Socialism and Liberation with the Philadelphia branch. It's an honor to be here alongside Manolo, Sina, and everyone else watching at home right now. Thank you to Qiao Collective for extending this invitation to me, and I'll be presenting on Vietnam's success so far in its management of the coronavirus. I'm going to share with everyone a PowerPoint. So 1 second, please. Can everyone see that? Okay, awesome. So to start off with some basic geographic and regional information, very similar to Cuba, Vietnam is a very small and densely populated country with over 95 million people. Its biggest city is in Ho Chi Minh with a population of over about 9 million. Its capital, Hanoi, here has about 8 million. The geographic background is super important here when we consider that Vietnam shares a border with China, and the distance from Hubei province, China, to Hanoi, Vietnam is only about 840 miles. But like this is really important when we consider the fact that Vietnam has seen very few cases, and we'll see that Vietnam is a socialist republic with a one-party system led by the Communist Party of Vietnam. The current president is Nguyen Phu Trong, and its prime minister is Premier Nguyen Xuan Phuc. They've been doing a wonderful job at leading the country through this crisis. So it's super important for us to recognize these leaders the same way that we recognize some of these Western politicians. So this is the brief timeline of when COVID-19 first spread to Vietnam. Vietnam entered into its first phase on January 23rd with 2 cases reported from people who had traveled to China. Vietnam's 6th case was declared on February 1st, and it led to an epidemic declaration signed by Premier Nguyen Xuan Phuc. And this declaration categorized the virus as a Class A contagious disease that can transmit very rapidly and spread widely with high mortality rates. It also entered Vietnam into phase 2, noting that the virus had spread globally, but still very easy to trace within Vietnam. Throughout the months of February and March, Vietnam continued to impose necessary social distancing and quarantine rules. And on March 20th, Vietnam entered into its 3rd phase, noting that infections were in the communities and the source of the infection was untraceable. On April 1st, a nationwide isolation order was put into place for 15 days. And on April 17th, Vietnam saw a dramatic change as no new cases had been confirmed. This Wednesday morning marked the 6th consecutive day in Vietnam without a new COVID-19 infection. And as of today, there have been 268 confirmed cases with 223 recoveries. So 45 active cases still, but 0 deaths. So this is the map of the pandemic in Vietnam as of today. The red indicates confirmed cases reported, and the blue signifies suspected cases. Overall, we can see that the majority of cases are in Hanoi and Ho Chi Minh, the 2 biggest cities. Nonetheless, though, most of the patients are released, and Fortunately, Vietnam does see itself in a position right now where it can relax a lot of its quarantine rules, some of the strict social distancing rules that have been imposed on its people. And in Hanoi today, its new social distancing rules had actually expired, and many non-essential businesses will finally be allowed to resume as long as they ensure proper hygiene practices to its employees and its customers. Both Hanoi and Ho Chi Minh have gone from high risk to medium risk areas now. And obviously this sounds a little nerve-wracking to us here in the United States because we're not expecting for numbers to stabilize anytime soon. In fact, we're expecting the opposite of Vietnam. As we continue to head towards the peak of the crisis. So opening restaurants again right now is unfathomable to most of us. This is the American timeline, and this map just puts the US government incompetence on full display. Unfortunately, the first public COVID-19 related death was on February 29th. However, the CDC did confirm that there have been autopsies that have shown there have been COVID-19 related deaths day before. A national emergency was not declared until March 13th by the Trump administration, when there were already at least 1,900 confirmed cases across 46 states. And on March 26th, the US officially led the world in confirmed coronavirus cases. As of today, there are more than 800,000 confirmed cases, and 44,000 people have died from COVID-19 in the US. This is very different from how Vietnam's public health system, because it's, the Vietnamese public health system is very centralized, and they're trying to scale up testing for the communities. In the US, different states and cities have different criterias. So for example, in New York City, due to shortage of supplies, testing is only performed for hospitalized patients. Despite limited resources, Vietnam has been able to effectively contain the pandemic with its prompt responses. The CPV has really shown its ability to mobilize its country, and it's enacted rigorous containment strategies in addition to communicating effectively with its citizens. Unlike the US capitalist class and the Trump administration, the Vietnamese government took super early measures to combat the current coronavirus epidemic. Officials began preparing strategies to combat the outbreak immediately after the first cases emerged in China, and then immediately organized a steering committee for COVID-19 prevention and control to accelerate responses to the pandemic. Because it's a densely populated country, the Vietnamese people face really high risks of exposures to deadly pathogens. So this requires a competent public health system that can rapidly respond to emerging challenges and also quickly disseminate information. So updates on zoonotic diseases are reported on a regular basis, defined as urgent, daily, weekly, monthly, or yearly. And because Vietnam's health system centers the safety and health of its people, not the profits of insurance companies, Vietnam has seen an impressive success in disease prevention and management. Example dates back to 2003, when it was the first country to successfully contain SARS. So this cooperative spirit among its people arises from a social system that emphasizes collective effort and unity of purpose. Contrary to popular rhetoric by Western media, Vietnam's success so far is not simply a miracle, rather a heavy planned economy with a socialist government that really puts people over profits. Vietnam is a middle income country with a fraction of the healthcare budget that other successful other Western countries have, yet its health service don't appear stretched. They've been able to socially mobilize across different cities and provinces. Here is an example of how Vietnam is tackling hunger amidst the coronavirus crisis by providing a 24/7 rice ATM that dispenses free rice to those who need it. Medical students as well as retired doctors and nurses have been mobilized. Vietnam's response had earned a high level of trust among its citizens. About 62% of Vietnamese surveyed, and in the single largest global public opinion study on COVID-19, think the government is doing right compared to the global average of around 40%. They have also been able to donate their supplies to other countries. Cuba, Italy, and recently the US have thanked them for their generous donations of masks and equipments. Here, the Vietnam's response have been praised by the World Health Organization, the World Economic Forum, and different international entities. And lastly, I just want to say that in this unprecedented time, we must embrace international solidarity more than ever and stand together with Vietnam, Cuba, Iran, and China, as well as the rest of the world. And that we should learn from the successes of the Vietnamese people and battle against all forms of anti-Asian racism that we're seeing, in the United States and other European countries. We must continue to demand a healthcare system that puts people's needs over corporate interests, and demand our government to be responsible to its people. What the US needs to do right now is administer free testing and free treatment, and really look to these socialist countries like China and Cuba and Vietnam to learn from them and learn from what they've been able to do so far and what they've been able to accomplish so far, instead of continuing its aggression against these countries. Thank you again for allowing me to give this presentation.
Thank you so much, Tina. Now we move on to Sina Rahmani, who will discuss Iran's experience amid COVID-19.
Hi, everyone. Thanks. I just want to thank all of you for attending this, all of you out there in internet land, and also to the organizers, Qiao. So I really appreciate this invite. Also say that what I'm going to talk about here today is less to do with the Iranian response per se. I'm going to touch on that, but more to do with the framework of representation around this. So, which is to say that I made a joke earlier a couple weeks ago, and I said, or maybe last this week, I don't know, time is meaningless, but I said, how do you all like being sanctioned now? Because this is what kind of the moment has sort of resided in, is that the idea of a sanction is not it's a kind of vague word, right? It means like a law or something, right? Or something goes unsanctioned means it's outside the bounds of the law. But the idea of a sanction, at least how it's used in sort of Western political theory, political science, is that it's a punitive measure, and that's for some kind of bad behavior. And this is the language of sort of Western political imagination to talk about their rogue states, right? Now, Iran is a special example because, and as my parents told me, Iran is the most special place on earth, so we get to be special in the world. And the lesson from Iran is the sort of can at least that's sort of noteworthy for us to think about here is what did it mean for the coronavirus to hit Iran very early. And Iran represents a different kind of statist state, which is to say, like China, like Vietnam, like Cuba, countries that are heavily organized around their state sector. And those are obviously more socialist in general, and the more and more your society is built around the state, obviously there's going to be a correlation to its relationship to capitalism. Now, putting aside those theoretical questions, what has been the example of the Iranian case has been, despite crippling sanctions, despite the refusal on the part of America and the Trump administration, the Trump regime, I should say, to even grant it a momentary relief from these criminal and illegal and quite purposely sort of genocidal sanctions. The fact that it refuses to sort of engage with anything to put down any of those punitive illegal damages is more reflective on the United States and has in fact backfired in terms of securing for everyone the truth, which is the US is the world's largest sort of rogue state, and the people that it calls rogue states, you can generally agree that, oh, these are just enemies of the US. And so in the case, what we've been seeing in this conversation today, and I think this is the great work that the Qiao Collective doing, is that what does it mean when the rogue states that are the enemy of mankind and freedom and blah, 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 what does it mean that they have handled this crisis so much better than our own rational, enlightened states, right? Like Italy, right? Like EU, like all of these states have just been devastated. Spain, like the list of countries, if you go by lists of like deaths, that the Europe and the US are leading, right? Like this has been hitting Western societies hard. Now there's complex kind of demographic reasons also that have to do with the age of the population, blah, blah, blah. But I'm not a scholar of that. I can't really make sense of that stuff for you on its face, but it's more interesting for me to think about the fact that Iran, everything to do with Iran and how it's represented is inflated by all kinds of regime change sort of thinking, what I call kind of in an episode that I did of my podcast called Regime Change Inc., and how the framework of understanding Iran's response to Corona has been filtered through there. So part of what we've seen, though, is that this backfired as the U.S. response and the U.S. Sort of crisis with Corona got worse and its own sort of state incompetence was exposed. Because in those early days, you can remember when it was hitting China, when it was hitting Iran, and it hit those two countries early, there were a lot of sort of snickering, sort of smirking media types on Twitter being like, oh, look, the Iranian health minister has Corona. Oh, like, look at how exposed they are. This is this is very telling for them that it's some kind of representation of their failed state, right? And there was a lot of, I guess the word I'm looking for is kind of triumphalism, like kind of sadistic triumphalism, not just on the part of, Guardian normies or Washington Post types, but these Iranian dissident journalists in the West, or these kind of respectable looking blue checkmark types. There was a kind of resounding agreement, consensus that, oh, this Islamic Republic yet again fails the people. And this is contrary to the facts. I mean, there's a great article that you should all read. It's by Vida Amélie. It's in the latest issue of NLR. It's called Sanctions and Sickness. It's free. It's been liberated from behind the paywall on NLR. So I recommend you go and check it all out. And this is like this I think sort of explains how, what we call sort of state incompetence, at least in the Iranian case, was really more of just like that this was a bewildering, brutal, viral epidemic that hit a country that was not expecting it. And no country has been expecting it, right? And this has been true, the universal truth of these last entire sort of 3 months of dealing with this crisis, is that no one really saw this coming, or at least if they saw it coming, they were not prepared for it. But how do you prepare for something that's going to cripple your entire society's movement, right? Can you really prepare for that? Now, the irony here is that this has not only did sort of in the early days did it kind of show the sort of vindictiveness and pettiness and sadistic sort of joy that sanctions people in the West who are professionals, right? Like people like Mark Dubovitz of the FDD, the Defense of Democracies, Foundation for the Defense of Democracies, or UANI, United Against Nuclear Iran. There is a whole Washington industrial sort of complex of just baseline morons who would fail in any other profession, but because they're paid by like right-wing psychos and petrodollars to sort of say anything they want, lie and make up stuff about Iran, then this gives them a nice six-figure salary. Right. I mean, this is the sort of simple situation, and China the sort of treatment is much the same. Yet I don't think the sort of Regime Change Inc. corporation or sort of machinery for China is as advanced as it is in the case of Iran. And Vietnam and Cuba are a sort of different example. I think Cuba is probably a closer example because Cuba, like Iran, has been a kind of rogue state, has been a kind of like champion rogue state for a while. Whereas Vietnam, I think, I don't know, we can kick this out in the conversation, but I think sort of occupies a different kind of rogueness now, partially because, the Vietnamese kicked the US's ass in a war, right? Like this can be kind of a psychological explanation for, at least at a state level, for understanding just the absolute insanity when it comes to representing how Iran has sort of made its way through this crisis. So I think I'm running out of time. I actually have no idea how much time I've been talking. It could be 1 minute. It could be.
You actually have quite a bit of time. Yeah.
Oh, I do? Woo,
yeah.
here we go. Okay. So
4 or 5 minutes. So finish
Wow.
up whatever your thoughts are.
This has never happened in my life. So one thing I did want to sort of jump in and to think about is the irony, the historical irony that we're kind of living in now, which is to say that the U.S. response to states that have upended and removed themselves from the kind of Anglo order or the sort of Anglo-American order of the 20th century that has come into our sort of being and watching happen, that we've sort of watched and experienced for the last 120 years or whatever, is that the few countries who have managed to not just kick out the US, but keep the US out, right? Cuba, Vietnam, China, like Iran, right? It's like no accident that we're all hanging out together on Zoom today, because we're all part of a very special and illustrious club, right? We're like part of like the Death to America club, like figuratively speaking, or I guess also literally, but in the sense that this has been, the response has been to every country in both, it's true, someone did point out they are allies. Allies in the sense of like, yeah, they work partners. It's a different kind of rogue. I don't think it's a rogue state. That's why I said that earlier. But I can't remember where I'm going with this. The point of all this, which is to say that the place of Iran in the American imagination and its own sort of unique Orientalist sort of machinery that's placed on top of it, I think can teach us a lot about how virtually every other country that's kind of in this club with them is represented. I mean, in the case of Vietnam, I think that means realistically that it's just kind of excluded from the imagination. I think Cuba comes in every now and then, but because of geopolitical things, because of the nature of West Asia right now and the sort of location of American sort of military importance and energy, is that the specter of Iran has played out, has loomed very powerfully. And so one thing I wanted to read is that there's a very sort of quote from Orientalism by Edward Said. This is a text that I go back to, which kind of explains how we can get here to the point where, you know, American newspapers report on Iran saying that, oh, you can see corona burial pits from space, right? I mean, this was peak Orientalist kind of sort of hate mongering, in the sense of this is kind of Orientalist wet dream. You have a failed state. The Islamic Republic's a failed state. You have always that thing of communists are burying bodies that you don't know about, that there's a death toll, death toll, death toll. This is something that's throughout kind of anti-communist hegemony. And you also have like, oh, they're lying about their numbers, right? And so these Orientalist kind of, fundamentally Orientalist kind of phrasings that say that, oh, the Oriental is liar, the Oriental doesn't represent themselves, that they can't be trusted. Like all these things sort of revert back to a kind of similar logic, right? Which is the Occidental mind is uniquely capable of locating themselves inside the world and using their enlightened imagination to figure out problems, right? But this coronavirus has exposed how just the simple fallacy of the sort of Western supremacist worldview, which is our free market system is so superior that if we just offered it to the world, they would come to us, right? Like, look at all those East Berliners jumping over the wall to drink Coca-Cola, right? Like, this is the garbage we've been raised on for a long time. And now it's finally becoming clear to people that maybe this was bullshit the whole time, right? It's like that GIF. Maybe it's like that GIF from those two English guys, Mitchum and Webb's, like, are we the baddies, right? Like, are we the failed state? And I think that's been kind of the irony of all this, is that it's forced that kind of mirror, that projection mirror that has been used to deal with Iran, or China, or like China is authoritarian, right? People say that, but in the same breath, they live in the world's largest incarceration state, right? Like, this is just objectively untrue to say that the US is not authoritarian and China somehow is, right? Like, you have to kind of, words mean things, and you have to kind of unite, you have to have a basis of things. And so if that kind of worldview is the basis of our conversation, right? Like China, Iran, Cuba, they all lie about their numbers. Maybe Cuba doesn't get that, but China, Iran, they lie about their numbers, right? Like, these casually thrown around things that express a kind of deeply, deeply Orientalist worldview. And how kind of the last thing I want to finish up on, which is the other historical irony, is that and this was what we were talking earlier, is that the countries that are sort of part of this club of nations that have sort of rejected U.S. dominance and the sort of global American order, right? The result has been to quarantine them, right? You quarantine the countries and put them around a bubble. In the case of Cuba, it's literally true, right? You put a blockade around them, like, and it's just lasted all these decades, right? Iran, to a degree, yes, that's what sanctions do. It prevents a kind of, it provide, those are the most modern ones. That's where they can kind of test them out, right? Because Iran is a sort of, even though it is a kind of cut off nation, it is deeply sort of, it is not like, say, North Korea, right? It is not unto itself in the same way North Korea is, right? That it's a deeply sort of large, huge, complicated society that has daily links between the outside world. I mean, I had somebody I know who arrived from Iran 2 days ago, right? So this is not a country you can simply, and its population, that you can simply cut off from the world. But they've managed to, for the last 40 years, quarantine Iran, as discursively speaking, as this kind of rogue state. And so and same with China to a degree. Now, the case of China is a complicated thing because while sort of making China a kind of, or the evil empire state of the moment, they also rely upon China to, like, for a lot of its own sort of commodity base, right? Like the world requires Chinese factories to keep its economy going. So it's different than in the case of Iran. I'm going to wrap it up here by simply sort of reading something from Edward Said to put it back from before and say that he talks about Orientalism, and he says that this is on page 203. This is something I always read to my students. Thus, Orientalism is not only a positive doctrine about the Orient that exists at any one time in the West. It is also an influential academic tradition, right? These are the China experts, right? Expert in the West or Iran expert. When one refers to an academic specialist who is called an Orientalist, as well as an area of concern defined by travelers, commercial enterprises, governments, military expeditions, readers of novels and accounts of exotic adventure, natural historians, pilgrims to whom the Orient is a specific kind of knowledge about specific places, peoples, and civilizations. For the Orient, idioms become frequent, okay? For the Orient, idioms become frequent. China is lying about their numbers. And these idioms take firm hold in European discourse. Beneath the idioms, there was a layer of doctrine about the Orient. This doctrine was fashioned out of experiences of many Europeans, all of them converging upon such essential aspects of the Orient as the Oriental character, Oriental despotism, Oriental sensuality, and the like. And this is the big quote. For any European during the 19th century, and I can say, and I think one can say this almost without qualification, Orientalism was such a system of truths in Nietzsche's sense of the word. It is therefore correct that every European, in what he could say about the Orient, was consequently a racist, an imperialist, and almost totally ethnocentric. Some of the immediate sting will be taken out of these labels if we recall additionally that human societies, at least the more advanced cultures, have rarely offered the individual anything but imperialism, racism, and ethnocentrism for dealing with other cultures. So Orientalism aided and was aided by general cultural pressures that tended to make more rigid sense of difference between European and Asiatic parts of the world. So I think in some ways we can use the experience of the coronavirus and our own media's response to it, just hilariously insane and incompetent response to it, as a kind of textbook case in Orientalism. And on top of that, as leftists, show how the neoliberal model, use this to prove how the neoliberal model of starving your state infrastructure, your healthcare, starving it of all its resources by privatizing it, by selling it off piece by piece. That what does it get you? It gets you a bunch of dead bodies. It gets you all like a machinery of morgues that are set up in refrigerator trucks, right? I mean, this is the real lesson. So I think just to close it off is that we're all sanctioned now, right? Like we're all under quarantine. And so this is a kind of insightful lesson to think about how politics happens in these conditions and beyond these conditions. So I'll end it there.